Welcome to today's video on sleep apnea, understanding, conquering, and supporting loved ones. In the next 5 minutes, we'll explore this common sleep disorder, its types, symptoms, consequences, and how to manage it effectively. There are 3 primary types: obstructive sleep apnea, OSA, central sleep apnea, CSA, and complex sleep apnea syndrome. Obstructive sleep apnea, OSA. This is the most common form of sleep apnea. It occurs when the muscles in the back of the throat relax excessively during sleep, leading to a blockage of the airway. Common symptoms of OSA include loud snoring, choking, or gasping for breath during sleep. Central sleep apnea, CSA. CSA is less common and occurs when the brain fails to send the proper signals to the muscles that control breathing. Unlike OSA, there is no physical blockage of the airway. CSA often results in pauses in breathing during sleep without any associated snoring. Complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea, this is a combination of both OSA and CSA. It can occur when OSA is treated with a continuous positive airway pressure (CPAP) machine, and CSA subsequently develops. Common signs and symptoms of sleep apnea: loud and chronic snoring, pauses in breathing during sleep witnessed by a partner, gasping or choking during sleep, excessive daytime sleepiness and fatigue, difficulty concentrating and memory problems, morning headaches, irritability and mood changes, frequent urination during the night, nocturia, decreased libido, sexual desire, dry mouth or sore throat upon waking. Consequences of untreated sleep apnea. Untreated sleep apnea can lead to a variety of serious health issues, including hypertension, high blood pressure. Sleep apnea is associated with an increased risk of developing high blood pressure, which in turn can lead to heart disease and stroke. Cardiovascular problems. It can contribute to the development of heart arrhythmias, congestive heart failure, and other heart-related issues. Diabetes. There's a connection between sleep apnea and insulin resistance, potentially increasing the risk of type 2 diabetes. Daytime impairment. Excessive daytime sleepiness can result in impaired concentration, poor work performance, and an increased risk of accidents. Mood disorders. Sleep apnea can exacerbate mood disorders like depression and anxiety. So, how can you conquer sleep apnea? Treatment options include lifestyle changes, losing weight if necessary, avoiding alcohol and sedatives, quitting smoking, and adopting good sleep hygiene practices. And by using continuous positive airway pressure, CPAP. CPAP therapy involves using a machine that delivers a continuous stream of air through a mask to keep the airway open. Bi-level positive airway pressure, BIPAP, similar to CPAP but with adjustable air pressure levels for inhalation and exhalation, which can be more comfortable for some. Oral appliances. Dental devices can be used to reposition the jaw and tongue, helping to keep the airway open. Surgery. In some cases, surgical procedures may be recommended to remove excess tissue, reposition anatomical structures, or implant devices like pacemakers for the diaphragm. Supporting a loved one with sleep apnea. If you suspect a loved one has sleep apnea, encourage them to seek a medical evaluation and diagnosis. Support and motivate them to make necessary lifestyle changes. Be understanding of any mood changes or daytime fatigue they may experience. If they use a CPAP or other device, respect their need for a quiet and uninterrupted sleep environment. In conclusion, sleep apnea is a common but treatable sleep disorder. Recognizing the types, symptoms, and potential consequences is essential, as is seeking appropriate treatment. Remember, supporting loved ones in their journey can make a significant difference in their quality of life. Thanks for watching.